Well, good morning, everybody. My name is Tim McGuire, part of the ALD Connect board, and it's just a privilege and honor to kick off this day, the Patient Learning Day. I want to thank you all for being here. I know it's a lot for many of you. We have, where's Petri? Petri came from Finland. That's a long way to come. Huh? Let's give him a round. Yeah, I was like, he came from Philly. That was 5 hours, so that was a piece of cake. So way to go, Petri. So since our founding in 2013, ALD Connect has built on a community, and today I can feel the energy, particularly with Kathleen's help, around us. Patients, caregivers, clinicians, researchers, advocates, and industry leaders and partners all together, learning from one another, supporting each other, and driving progress as a united force. What energy we had yesterday, too. I'll tell you, I have to give another shout out. That patient panel, was that spectacular or what? Let's give a round. Mike did a great job. I also want to welcome, who's here that's here for the first time? First timers. We have a lot of first timers, so welcome. This day is for you. What I would tell you is, I've been coming to these meetings for a decade now, and the first day, it's amazing to see these brilliant clinicians and scientists working together and talking, but they talk a different language than most, right? Which is good. We want them talking the right language. But I don't have any technical things to cover with you today. What I hope to give you is hope. Today is about hope, and we're going to talk about the breakthrough research that we have, right? Breakthrough research. This year we launched the Breakthrough Research Fund, which is really a bold new initiative for us to go for a cure, to really come up with better treatments, better options for families and their loved ones. So ALD Connect is dedicated to investing in the most urgent priorities, and it gives us all hope for the future. So what is it? So our goal, we have to have a goal, right? Our goal is to hit $5 million in funds. We're launching it now. Today is the first official announcement, so thank you all for being part of this. And this is, yes, thank you. This is really to work on projects will improve diagnosis, expand treatment options, and lead to a cure. Families living with ALD urgently need meaningful progress, and today is just about that. So what is our mission about research? Number one, we want to advance scientific discoveries. You saw the brilliant minds in the room yesterday. How can we harness the collaboration and accelerate developments and treatments, which that is what we do among these investigators. If we could get collaboration and patient-led agenda for the most urgent scientific and clinical questions in the ALD space. So what's our priorities? So our three major priorities, we will work to detect this disease earlier. Many of you are here because of newborn screening. Just a few years ago, that didn't exist, and thankfully, it does today. We want to detect it earlier. We want to predict symptom progression sooner. We want to develop safer and more effective treatments, and we want to improve the quality of life for patients and their families. Our vision is a future where a diagnosis no longer brings fear, uncertainty, pain, and suffering. So how do you get involved? Number one is there's so many ways you could donate. There's a QR code there. Anything you could do, scan the QR code, take a moment, and see how you could help us in any way. We had a gentleman that was here and his family, Julia and Porter Gould, and their Julia's brother, Stuart Smith, was an avid giver to our organization. And this year he pledged $1 million towards our $5 million effort. So, and Porter and Julia, thank you for your support in this effort and for bringing your brother to the table as well. It's impacted their family significantly. Their son, Robbie, is AMN patient, and they're committed. Their family's committed, and many of our families can be committed to doing anything to help in this cause. So how else can you do? Well, certainly you could donate, you could fundraise through events, we could do personal campaigns, volunteering your time, your skills, your advocacy by sharing your story, partnering as a clinician, researcher, or industry member, and helping spread the word by sharing our mission. Every action helps us drive progress and brings us closer to breakthrough. So I'm excited about our future together. So next up, I want to recognize somebody who's very special to our organization, Kelly. Everybody knows Kelly. There she is in the back. This meeting and all the planning that goes into this meeting would not be possible without Kelly. But Kelly does so much more that you don't see. She's quiet behind the scenes. But she's amazing, an outstanding leader who's been pivotal in driving our mission. She's helped us kick off the Breakthrough Research Initiative. Her dedication, her strategic insight, and is truly commendable. And on behalf of my colleagues on the board, we want to express our thank you, and to this community express our deepest gratitude for all you do. Kelly, thank you very much. So with that, we'd like Kelly to come up to the front here. We have a little gift for her and some flowers. So come on. She doesn't like surprises, by the way. So we had to fill her in. I said, can you give me some nice pictures? That's her with Spock there. So come on out. We'll get a picture. If somebody can take a picture. I don't know if we have a photographer here. So Kelly, you're amazing.
Thank you.
And by the way, I got an email from Kelly the other day. Here we go. We'll get up front here. This is for you. This is signed by all the board members there. I think I missed Josh, so I'll get Josh. But anyway.
Josh, of course.
Now I'll turn it to you.
Thank you.
Now I'm going to turn it to her to do the real work.
Okay, thank you. That was really nice. I really appreciate it. So I do not, Tim is right, I do not like surprises, but it was really meaningful, so thank you. Okay, so good morning. Thank you all for being here. We had an incredible day yesterday. It was full of science and an amazing patient panel. This morning, our agenda is that we'll hear from our scientific director and then from our industry experts before our ever always popular breakout sessions. Then we'll have lunch and an opportunity to ask the experts. So if you have any questions, if you didn't have a chance to ask something yesterday, there'll be an opportunity for that to happen after lunch. Then we'll do another breakout session, and then we will announce our prize winners and celebrate our auction. So that's what today looks like. And I know some of you have to leave and catch flights, so I do want to take an opportunity to just thank you all for being here if I don't get a chance to do that later. So on behalf of our organization, thank you so much for making the trip or coming over for the meeting and spending these 2 days with us. It really means a lot. Thank you to our sponsors. This meeting would not be possible without you. I think most of you are in this room, so we really appreciate your support and also for being here and engaging with our community. So once again, thank you so much for making this meeting possible. Okay, I just want to do a really quick overview about some of the things that we've been working on. On your tables, you have our 2024 annual report. It's a great summary of all the work that we did last year, so please take time to read it and then watch for our 2025 annual report to come out early next year. So many of you already know about the programs we offer, but this is just a real quick overview. We have monthly community calls, which are essentially support groups. We co-host one with Alex TLC, and we also have a mental health call. In addition to that, we have a mental health, peer mentor program that connects newly diagnosed patients and caregivers to a mentor in our community. So we have several mentors or mentees in this room. I think it's a really great program. So if you have any questions about that, please reach out. And then lastly, we have patient and family support programs in our Michael Benton Travel Scholarship Program. So we try to provide financial assistance to eligible people in our community to help them offset costs or help with travel. So I'll hit a couple highlights of a few of the things that we've worked on this year in 2025. A super exciting initiative is this. It's our ALD Landscape Project. Our goal is for this to be the global census of individuals living with adrenal leukodystrophy. This is important because it helps us demonstrate the need for new treatments. It helps our industry partners with business cases, and it helps us identify geographic areas or hotspots for programming. So there should be business cards around, probably on your tables. It's a super short form, but it's really helpful. So if you're a patient or caregiver, please take time to fill that out. We have also continued to work on our information sheet series. So we have one about the importance of MRIs for men, and we worked on this year. This year, it's for symptomatic women with ALD. We are working on several others, and we're happy to have suggestions for other resources that might be helpful to you in the community. This is another important update, so we're excited to share that we advocated for this, and ABCD1 was added to the newest version of the ACMG list for reporting of secondary findings in clinical exome and genome sequencing. So previously, if testing was performed for another reason, the ABCD1 results might not have been reported, but going forward, it will be. So this is really big news for our community and something that we'll continue working on. This poster was presented earlier this year at a conference. It's a really nice overview of our organization. I believe it's still over there in the next room, so please take time to check it out. One important call out here, though, is this timeline. So we started our patient-focused drug development work way back in 2021, and we learned just last week, Amina, that our manuscript was accepted for publication. So another huge win for us. We're super excited that patient and caregiver perspectives will now be available in the literature. We are also excited to share that we funded 2 emerging investigators this year. This program is really important for us because it helps us engage the next generation of researchers in the field of ALD. And of course, we want as many of the brightest minds as possible thinking about the disease. So the way it works is that we have our applicants present to what I call our Shark Tank, our ALD Shark Tank. So they present to all of our experts in a Zoom meeting. And they get asked questions by our experts and then need to defend their project in order to receive funding. So then they work on their projects for a year. They present them here at our annual meeting in Patient Learning Academy. And our hope is that they will stay in the field. And we do have an exciting update from a former emerging investigator that we will share a little bit later. And then another big project is that we launched a new website this year. So this is new and improved. Hopefully, I'm not sure if anyone remembers our old one, but this one's a lot better. We spent a lot of time on it. It was a huge, huge, huge undertaking. So thank you to our staff and everyone who helped make this possible. A lot of what I've just talked about is on our website. But if you have any questions, feel free to reach out. It's just aldconnect.org. And then lastly, we are proud to share that we completed year 1 of our Chan Zuckerberg Initiative grant and have received the second allocation of funding. This is an $800,000 award over 5 years. So again, really big news and really exciting for our community. Felicity and I had the privilege of going out to a big CZI meeting in May. And got to meet with a lot of other rare disease organizations and leaders. So just incredible opportunity.